Welcome back, everyone, to OpenLine. Glad you're with us. Talking mental health tonight. We have with us Amanda Bracht with the Mental Health Cooperative, Inspector David Imhof with the Office of Alternative Policing Strategies. And we have a bunch of calls. We're just going to go back to the phones. Let's go to Mike. Hello, Mike.
Hey, good evening, Ben. Good evening to the Councilor Bracht and also to the Deputy Chief or Inspector. He got a lot of gold on, that's all I know, so he must be pretty important. I have a aunt whose next door neighbor that lives in Nashville has had a lot of problems with her son, who is now 23. And the police, Metro Police, have been there several times for little different incidents, but nothing that got to a point where they needed to put him in handcuffs. But her, the mom, and her daughter are pretty much living on, walking on eggshells, wondering what's going to be the next crisis. The police say there's nothing they can do until he breaks the law. My question to you is, what do you do in a situation like that where the mother may feel like, I don't want to put my baby, because to a mother you can be 100 years old and you're still her baby in her eyes, go to jail and what could happen in jail or whatever. So do you have any recommendations that I could pass on to them? And also, do your cops carry crisis cards that have different agencies that they can call for everything from homelessness to just getting on their feet with a list of Metro or government services? And I'll hang up and listen. You guys have a good night. Thank you.
Thank you, Mike. That's a great question. Who wants to take that? You can both take it, but you want to start
off with the last part of his question as far as the resources. Officers do have, there's a variety of resources in Davidson County. There's so many that we're blessed in our community to have so many different resources, whether it's dealing with the unhoused, food, mental health, whatever it may be. And officers do have, there's books actually that each officer is assigned that has, and the public can have those as well, but gives you resources for every type of situation you can think of. So we do have that. Now, if we experience someone who's having a mental health issue, a lot of times we'll call Mental Health Cooperative and talk to the mobile crisis folks there to have them run it by them to see what we need to do. But also, I think whatever precinct that particular family's in, the community coordinator at each one of those precincts. Each precinct has a community coordinator or a community outreach person that really is in touch with all the resources within that precinct itself. So I would always encourage folks, if you're looking for a resource, you can call the precinct that you reside in and talk to the community coordinator and talk about the situation, find out what resources are applicable for them.
So that'd be one recommendation for that family, but here's a mom.
Sure.
He says they're walking on eggshells, concerned about their kid, and he's older or whatever, but they're worried about calling police, but sometimes they don't have any other option. What do you recommend?
Well, depending on the situation, not knowing a lot of the details, if the mom or other relatives can convince the son to get some help, they can bring them into our crisis treatment center in Metro Center. I believe we'll have the number up, but it's a 24/7 number that they can call, and if they can get him to agree to come in, we can assess him 24 hours a day. So that's one resource. I think the other resource is, as Inspector Imhof said, is really reaching out to their precinct, and there's times where we co-respond even when it's not a co-response situation, where the family is saying, look, we can't get them to get help, we're really concerned, we're worried about their continuing deterioration. The officers will work with our staff to get a clinician out there and assess the individual. But those type of scenarios are very difficult. If the individual is not willing to get help, and they don't meet the criteria for involuntary commitment, we have to try our best to build rapport, gain their trust, and hopefully convince them to get help. And that's not an easy process.
No, and it's so good we have this program, because police have always been the people that people call. And this is a hard thing to deal with, and police have to have people comply and that kind of thing, and it can be very difficult. And so I think sometimes people are scared to call. But with this new program, it should take a little bit off their mind, but it's still scary for a mom to call.
Absolutely, and I think, I hear it all the time, and I totally get it, where people say, I'm afraid to call the police because I'm afraid of what's going to happen. However, sometimes you have to. If the situation is deteriorating to the point you are fearful for your own safety and the safety of your loved one, we've got to get you some help. And one of the things that I think is great about this program, to the point you were saying, officers have been faced with this for as long as there's been police officers. Now with this program, we're giving them the training and the resources to hopefully be able to intervene appropriately and to be able to get the people connected to care versus saying, well, I don't know what I can do. I may have to take this person to jail, or I'm just going to leave them here. It gives them an extra tool that they really need to get people into treatment and to provide safety for the community.
What about the precincts where this isn't happening right now? Because you said there are 2 where it's happening, right?
Yes, sir.
And so there are 2, or there are more than 2 where it's not.
Yeah, so there's 8 precincts in Nashville.
Right.
And we have 2 that are involved in this program. So, you know, Mental Health Cooperative has a mobile crisis unit, as we talked about earlier. And that's been around since 1993. It just happens to be the year I started on the police department. So that has been our resource we've had for years. So typically, officers go to a scene, kind of evaluate the scene from our perspective. We kind of see that there's a mental health component here. Well, this is outside our scope. So we would call Mental Health Cooperative and say, or Mobile Crisis, and say, this is the situation we have. How do you advise? And 3 options. They can either say, well, I'm going to come out there and evaluate this person and find out what we can do to help. You can bring them up to us in the crisis treatment center currently. Or we can meet you at the hospital because the acuity is so high, we can already tell by what you're telling us on the phone and what's going on the scene that this person needs to be transferred to the hospital, and we'll meet you there for an evaluation. So those services were in place before we started our program. Those services are still in place for those precincts that don't have this program. Our goal right now is we're going to expand over to Central Precinct, I think Monday, May 16th. And then we're hoping to expand 1 precinct after that every 6 months.
Oh, that's great. All right, so it's definitely expanding. Let's go to William. Hello, William. Are you there, William?
Hi, yes. I was just wondering, first of all, I wanted to say thank you for what you guys do. I'm a home health care worker specializing in the disabled. And the lady before had said, you know, that you really have to have a heart to do what you do. And I greatly appreciate that, as I have a heart doing what I do. But I was wondering, what might one do to go about being of help, or start off as a volunteer, or if they're searching for a career? What kind of training can we look for in order to help with this mental health crisis? Because it is so severe. I'm sure that there are people out there who want to be of more help, and they just don't know where to even look, and they might get, you know, distracted by other things.
That's a great question. All right,
that's a great question.
What about that?
There's so many different options, and there's so many different levels of help that is needed. One program that's come around in the last couple of years that I'm very excited about is what we call peer support specialists. And peer supports are people who have lived experience with mental illness and or drug addiction themselves. They've been stable for many years, and they go to training that's done by the state of Tennessee. And most of the trainings are free, and they can become certified as a peer. And then they work in places like the Mental Health Cooperative, some of the other mental health centers, some of the hospitals. Middle Tennessee Mental Health has some peer support folks. They are paid employees who are able to provide supportive counseling to people by sharing their experience with recovery. And that's so incredibly powerful. They instill hope for individuals. There's also, I mean, we all the time need psychiatric nurses, so nurses who really have a heart for mental health. It's a great area to go into. There's great opportunity for advancement. And then bachelor's level and master's level mental health professionals, social workers, people in psychology and counseling who want to work directly with people. They don't want to be sitting behind a desk all day long. They want to actually, you know, be interacting with folks and see positive change. And, you know, we've got great colleges and universities in the city who provide training in those areas.
Generally speaking, what level is going out with police officers all the time?
The co-responders are all master's level clinicians in either social work or counseling, psychology, and they're pursuing their license in their discipline, or they are licensed.
Wow. Okay, very interesting. On Facebook, somebody said we need more mental health help in schools. What are you seeing, and what about that area?
We're definitely seeing a need in schools, and some schools have counselors that are working specifically to help identify children who may need some extra support. This is beyond what a general guidance counselor they do great work, but more than what they can do with the volume of students that they have. This Department of Mental Health has also started some grant-funded programs where they are supporting placing master's level counselors in schools to help relieve the pressure from teachers and from school guidance counselors in trying to identify with more or identify and address some more serious mental health issues. I really hope and anticipate that those programs will expand throughout the next few years because there's such a need.
And they're saying we need to go to break again. But then when I hear you say that, I mean, I feel like every time somebody comes on to talk about mental health, I ask, how are things going? And I feel like it's always, well, you know, things are not good. But we're talking about it more. Are we getting just worse, or are we getting better at identifying it? I just get concerned every time I hear, and obviously we've come out of a pandemic, so that makes sense, but are things just getting worse? Or are we better at identifying it, or what do you think?
I think it's a combination. I think we're much better at identifying things and talking about it, which is good. But I also think that I think the stress of coming out of the pandemic, social media, when our children, we know that has a huge impact on our children in particular, and some adults. Those stressors, prolonged stress, vets coming back from situations overseas and see the trauma, first responders and the traumas they see. Long periods of that, sustained stress and trauma over and over again, can lead to issues. And I think that we are getting better at talking about it, but we've got a long way to go in terms of getting ahead of it. Now, I will say treatment is getting better in regards to medications. You know, we think about the advancements in psychiatry in the last 50 years. You know, we didn't have medications 50 years ago to treat many of these illnesses. People were locked up. They were locked up in institutions for the rest of their life. Well, we've now been able to advance medications to treat things like schizophrenia, severe bipolar disorder, so that if people stay engaged in treatment, they can live a fulfilling life. So there is some bright side. You know, we do talk a lot about the negative, but we have come a long way, but we still have a long way to go.
Very good. Okay, we'll take a break. Come back, continue our discussion right after this.